Good morning, everyone, and thank you for making today's symposium. I'm Christopher Schneiders, Director of the Sachs Institute for Mental Health Law, Policy, and Ethics at the USC Gould School of Law. And now I will turn things over to Andrew Guzman, Dean of the USC Gould School of Law and the Carl Mason Franklin Chair in Law. Andrew?
Welcome, everybody, and hello. I hope you are well and that your loved ones are well and that you're staying safe. On behalf of the USC Gould School of Law, I'm delighted to welcome you to our 11th annual Sachs Institute Spring Symposium. We're so delighted to be resuming this tradition. As some of you know, last year's event, which was to be on immigration, asylum, and mental health, was canceled as the pandemic emerged. This year, with the pandemic still with us, we're thrilled to be able to offer our first ever virtual symposium. And this year, we're addressing psychiatric advanced directives and the importance of choice. Today's event has drawn attendees from across the mental health community, including the law and policymaking fields, consumer and peer advocacy, county behavioral health systems, law enforcement, students, family members, academics, and more. So thank you so much for making the time to join us. Your participation speaks the importance of the discussion and the topic and the impactful work of the Sachs Institute. At Gould, we aim to be at the forefront of scholarship that benefits people and communities. And there's no doubt that the Sachs Institute is pivotal to our efforts to achieve that goal. For more than a year, the Sachs Institute has been supported by California's Mental Health Services Oversight and Accountability Commission to facilitate planning for an innovation project, which will be undertaken by several counties statewide. The focus is on creating trainings, programs, and systems while engaging peers and numerous key stakeholders in a meaningful way as part of an overall effort to implement Psychiatric Advanced Directives, or PADs, or Mental Health Advanced Directives, as a form of supported decision-making. The symposium today epitomizes the life's work of Professor Ellen Sachs and the ongoing efforts of USC Gould's Sachs Institute for Mental Health Law, Policy, and Ethics. Since it was established in 2010, the Sachs Institute is consistently engaged in cutting-edge programming, research, and projects in an effort to change the way society views and addresses mental illness. Its primary goal is to promote respect for individuals with serious mental health challenges while advocating for autonomy within societal structures and improvements in our legal system. USC Gould and the Sachs Institute are so grateful for the support of the Mental Health Commission for this important, innovative effort. We also thank our supporters who have ensured the advancement of the visionary work of Ellen Sachs and the Institute over more than the last decade. The Institute would not be able to fulfill its mission without the contributions of many friends and champions. And so in particular, I would like to thank the following individuals and organizations for their generosity: the Doris Bride Trust, the Sidney R. Baird Jr. Foundation, the Anthony and Jean Pritzker Family Foundation, Richard and Christine Getz, and Jacqueline Klein. And now I'm delighted to hand the virtual microphone over to our next speaker, the Executive Director of the California Mental Health Commission, Toby Ewing.
Thank you very much. I appreciate the opportunity to join you today. I want to thank USC, the Sachs Institute, and Ellen and her team for putting today's event together. My name is Toby Ewing. I am the Executive Director of the state's Mental Health Services Oversight and Accountability Commission. To save that everybody's brain as you think about all those words and all those letters, we just say California's Mental Health Commission. We are an oversight agency of the state of California, and we're pleased to be able to sponsor today's symposium and to join you today. We have many of our staff listening in throughout the day. Our commission, this California Mental Health Commission, is charged with driving transformational change in our state. And we're thrilled to partner with the Sachs Institute on this exciting project that is the focus of today's event. In many ways, Ellen envisioned this day unfolding and the work that we have underway. It was about 2 years ago that she invited me to one of her symposia and arranged for me to meet with Lori Hallmark, one of your speakers, to talk about how we can improve how our mental health system responds to people with mental health needs. I'm very excited about the progress that we've made and very excited to see all of the presentations and the conversations that are happening across the state of California and that will happen today in this event. Before this pandemic, and even more so now, our mental health system has struggled to respond to people with mental health needs. Even when we have been able to respond, we often do not do so in ways that are the most effective, that address broad community goals or that meet individual needs. We struggle to tailor our response to the needs of individuals in ways that are empowering, that are recovery focused, and that are culturally competent. It can be quite rare, in fact, that we respond in ways that are empowering, that begin with choice, that begin with opportunity and self-determination. And it's unfortunate that we need to have a discussion on something as foundational as choice and on a tool in our health and well-being toolkit as routine as an advanced directive. Stigma is part of that challenge. And that too is on our agenda as we think about empowering the people that we care about, the people we serve, the people we love. Today's discussions really are about choice and empowerment, and they're about transforming how we think about mental health and how we respond to needs. Despite the often heroic efforts of mental health leaders, peers, consumers, family members, and thousands of community partners, our mental health system is generally falling short on almost any measure of success: access to care, recovery, jail involvement, suicide. We are not meeting goals. We face a range of challenges, but the good news is that these challenges are not insurmountable. That's important. Despite those challenges, we have incredible resources to address them in this state, and we have hope. California's Mental Health Services Act provides us with hope and opportunity. It provides a policy framework that offers guidance, and it offers tools to fundamentally transform this system. And that really is part of the focus of today's event. So first, I want to talk a little bit about the guidance that California's Mental Health Services Act provides. It sets a high bar for responding to mental health needs. It prioritizes recovery, peer empowerment, and community engagement, three pillars that are foundational for the kind of work that we need to do in California to strengthen our response to mental health needs. It recognizes that to fully transform our system, that system needs to be shaped by, and it needs to respond to the needs of community members. Mental health peers must be at the table, involved in all aspects of the decisions made on mental health services, as well as on policies and practices in this state. Even more importantly, peers must be at the head of the table, particularly with regard to the care that they receive. Remember the importance of choice and empowerment. We might refer to that as peer-driven decision-making. State policy recognizes that our traditional approach to mental health care has been reactive. It has not been peer-driven decision-making. One theme on the agenda today is how we can support peer-driven decision-making. We're very excited to be part of this conversation. The Mental Health Services Act also calls out the need for prevention and early intervention. This point is highly unusual in mental health. If we were in person, I'd ask you to raise your hand and tell me whether or not you have had experiences in the mental health system, or how much of your work and training as a provider, or how much of your preparation to work in this field has been based on a prevention foundation. Typically, that is rare. Some of you may have benefited from those experiences, and the good news is we're quickly moving in this direction. The work of the state Surgeon General around adverse childhood experiences has been very helpful. We've learned a lot about implicit bias in the last few months, unfortunately due to tragedies around this country, but we really need to emphasize a prevention foundation for the work that we do if we're going to be able to respond to the needs that are so clear across our community. The Mental Health Services Act specifically mandates prevention and early intervention, and that mandate is very broad. It addresses housing, employment, family connectedness, educational opportunities and success, avoiding criminal justice involvement, supporting suicide prevention, and supporting overall health and well-being. California's mental health system focuses on the well-being of the people we care about, our consumers, peers, family members, and if we really think through a prevention lens, it is focused on all Californians because we want to engage early in improving understanding of mental health needs and preventing their escalation as effectively as we can. The nature and the design of public policy around mental health in California has been passed directly by the voters, and it is very unusual. It goes far beyond federal Medicaid policy, what commercial insurance covers, and traditional mental health practices in most countries, even in the United States. But we also have some very powerful tools to support this vision of prevention and empowerment. And one of those tools is what we're talking about today in terms of some of the innovation support. California sets aside between $350 and $400 million each year for prevention and early intervention. That's a sizable investment that is likely unmatched anywhere else in the country. Yet we are still exploring the potential for mental health prevention, and we believe that potential is far more profound than we currently understand. We also have this innovation tool. Prior to the passage of the Mental Health Services Act, it was common to hear from consumers and family members that they faced tremendous difficulties in addressing the gaps in the mental health system. They would try to access services and would get a clear presentation of what was available, and what was available would fall far short of meeting their needs. The common refrain was that the best way to improve care in your community was to move to a community that offered better care. Moving, however, was not an option for many of the most vulnerable people that we serve. In response, California's Mental Health Services Act also mandates innovation. It sets aside more than $100 million every year to think creatively about how we can improve our system. These funds are available to facilitate exploration, analysis, community engagement, to develop ideas on how to fundamentally rethink, reshape, redesign, and improve the systems we have in place and the outcomes that they're achieving. There is some brilliance to this policy. We want today's event to be part of bringing you into this brilliance. This policy challenges a state like California with its diverse individuals and communities, its incredible infrastructure of counties, colleges, universities, outspoken young people, experienced older Californians, the creative talents of our technology and entertainment sectors, and most importantly, empowered peers and family members. It challenges us to imagine something better. And several years ago, we had an idea, a very common sense idea. The state was struggling, and it still is, frankly, with large numbers of people who are sent to jails, who are living on the streets, who were in prison, who are in state hospitals because of unmet mental health needs and criminal justice involvement. Too many people in California are facing criminal justice charges and are deemed incompetent to stand trial for what really are unmet mental health needs. The common sense idea was to look at how our systems work and identify opportunities to better support people with mental health needs before they become involved in the criminal justice system. With $5 million of state funds, the Commission launched an innovation incubator to focus on reducing criminal justice involvement. The project that is the focus of today's symposium is one of several that is designed to bring together community mental health funding with community support and engagement to reduce criminal justice involvement and support recovery, empowerment, choice, self-determination. In partnership with Fresno County, the Commission's Innovation Incubator turned the idea of deploying psychiatric advanced directives with tremendous support from USC and the Sachs Institute. This is a form of supported decision-making. This project is both designed to empower mental health consumers to lead in the design of their care and to shape how the mental health system responds to those needs. Ellen and Christopher from the Sachs Institute were quick to recognize the opportunity with Karen Cejudo, who you'll hear from later today, and they're helping to bring this vision into focus. The concept of psychiatric advanced directives is not new, but the potential is, and it's enormous. This project builds upon the values of the Mental Health Services Act: recovery-focused, peer-driven, prevention and early intervention-oriented, innovative, and focused ultimately on systems change. There are many challenges ahead, and California has the talent, the creativity, the partners, the base of incredibly intelligent and driven peers, and a range of supportive allies who collectively can bring this project to success. To date, we have 5 counties that are interested in investing in this work: Fresno, Orange, Shasta, Mariposa, and Monterey. And the people who work in these counties and communities have been incredible at imagining what this project might look like. Collectively, they're proposing to invest slightly over $17 million in local funds to help us explore how psychiatric advanced directives can help push our mental health system in the right direction. Today's symposium really is helping to launch this work. I want to thank you again for the opportunity to join you today. I look forward to the presentations throughout the symposium, and we're all very excited to see how this innovative approach to prevention and early intervention, recovery, and support can help transform California's mental health system. We're also super excited that if we can make this work in the set number of counties who are engaging early on, that we can scale this not just statewide, but across the country. The foundation is here, the ideas are here, the energy, the enthusiasm, the partners. Thank you very much. for the work that you do every single day. Thank you for joining us today. Thank you again to Ellen, her team, to USC. And I'm really looking forward, on behalf of the commission, myself, and my entire team, to seeing how today's conversations unfold. Before I step away, I have one more chore, which is, it is my pleasure to introduce a short and compelling video by Painted Brain. Thank you.
Choice is important to me because so often people make decisions for me. Choice allows me to choose how I want to be helped, how I want to be served. Choice allows me to be free to make my own decisions. Choice allows me to voice what I want, what I need. Choice allows me to be free.
I am my choices, and choice is who we are. Everyone is a sum total of their choices. Choice makes us. When you deny me my choice, you deny me myself. Choice is important to me because I want to be the author of my own script, and especially when it's something as important as my own health. Too often, people say that those with disabilities should not be allowed to make their own choices.
I think the importance of choice and psychiatric advance directives is something that I think a lot of people overlook because they think like, of course, I have the power to choose. I can choose whatever I want. But sometime when your choices are questioned and someone says, you know what, this person doesn't make as good of choices as me, so this person shouldn't make any choices. This is often what happens to people in the psychiatric setting. Because they can't make some choices, they're deemed to be incapable of making all choices. And that's something that we really don't believe in.
Supported decision making is important to me because it's something that I do every day, all the time. Whether it's going out and asking a friend, hey, how do I change a tire? Going out and asking for advice on what you should do next in applying for a job process. Supported decision making is something that we do all the time without even realizing it. Too often, people with disabilities are told that they don't know or understand enough about themselves to make decisions for themselves. And this is used as an excuse to give them treatments that they don't agree with or to prescribe them medicines that they don't want to take. Supported decision-making is something that should be available to everyone regardless of disability because it gives them agency and the ability to feel like they are in control of their decisions and what they decide to do in their lives.
As a Black woman, choice is very important to me, especially with psychiatric advance directives, because too often, particularly in the medical system, myself have been discounted, not believed, and questioned when I had a concern. The ability to make choices is important, particularly in my health, because I want to be able to tell people how I want to be treated. I often hear of particularly women of color saying that they're not believed. So for me, this document, Psychiatric Advance Directives, will give legal force.
So like a lot of people, I didn't know about psychiatric advance directives until very recently, and I'm upset because it's such an amazing kind of document to have for people who are going through a lot of mental stresses and strains in their life. Psychiatric advance directives gives you the ability to choose what kinds of mental treatments you would like to receive before a psychiatric emergency occurs. This gives the ability for people who oftentimes have their choices taken away from them and their right to choose stripped from them, gives them back that ability to choose and gives them more agency to live their own life.
So the role of peers in psychiatric advance directives. So, you know, peers are so valuable to psychiatric advance directives because the power relationship is equal and there's not one person on top of another. You know, psychiatric advance directives cannot be put onto peers. They need to be created for peers and by peers. And this process will make the psychiatric advance directive ours, not a treatment facility, not a doctor or anyone else. It really should belong to the peer. It should be from the peer's perspective.
In the Black community, psychiatric advance directives are almost unheard of particularly amongst myself. I never knew about psychiatric advance directives. So this document will be a force that will allow us to advocate for how we need help and support. Too often, Black individuals are responded to in a way that's not appropriate for what we need. Psychiatric advance directives will allow the Black community to have a voice, to be able to advocate how we want to be treated with in health, law enforcement, and housing.